Hi, I am Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. At the recent annual meeting of the SVS in San Diego, our journal recognized three major contributors. Dr. Joe Mills from Baylor College of Medicine, Houston, Texas, with his co-authors for winning the award of the most frequently quoted paper of the JVS in 2016. Dr. Tom Probstl from Mannheim, Germany, and his co-authors for winning the most frequently quoted venous paper in 2016 in the JVS Venous and Lymphatic Disorders, and Dr. J.R. Chung, also from Baylor College of Medicine in Houston, Texas, for winning the 2016 Best Reviewer Award of the JVS. Congratulations to all of them. We have some excellent papers to choose from in the July issue of our journal. The Editor's Choice article is entitled "Female Sex Independently Predicts Mortality After Thoracic Endovascular Aortic Repair for Intact Descending Thoracic Aortic Aneurysms." This study of the Vascular Quality Initiative was written by Dr. Sarah Deary and colleagues from Boston, Philadelphia, Charlottesville, and Gainesville. The authors analyzed data of 2,574 patients with elective TEVAR. Women were somewhat older, had smaller aneurysms, but a larger aortic size index. Both 30-day and 1-year mortality rates were higher in women than in men, and women had significantly more major adverse events. Female sex was the most significant independent predictor of mortality after TEVAR, together with renal insufficiency, followed by anemia, age, and aortic size index. Survival of women was also significantly lower at 2 years after TEVAR. The data support the recommendations of the authors that female sex be considered an independent predictor of mortality after elective endovascular repair of thoracic aortic aneurysms. The next paper by the team of Dr. DiMartino and colleagues from Mayo Clinic is our CME paper that you can download free of charge this month. First authored by Dr. Ramoncito David, the paper is entitled "Early Extubation is Associated with Reduced Length of Stay and Improved Outcomes After Elective Aortic Surgery in the Vascular Quality Initiative." The authors studied 171 patients undergoing open elective abdominal aortic surgery and found considerable variability across the VQI in extubation in the operating room, ranging from 0% to 100% of cases at each center. Delayed extubation out of the operating room was associated with a progressively prolonged length of stay and morbidity, and more extensive operation like suprarenal aneurysm repair also predicted increased length of stay. The most important variables contributing to delayed extubations were total operating time, estimated blood loss, and the need for postoperative vasopressor therapy. The authors suggest that the timing of extubation is important for patient outcomes, and standardized perioperative respiratory care would likely improve outcomes and reduce length of stay. The next paper comes from Dr. Islami's team from Pittsburgh and Boston, first authored by Dr. Seltzler, and it is the association of the CREST trial and the CMS Carotid guideline publication on utilization and outcomes of carotid artery stenting among high-risk patients. Carotid artery stenting was used with increasing frequency for high-risk patients starting from 2005 up to 2011. Compared with carotid endarterectomy, stenting increased the odds of in-hospital mortality in symptomatic high-risk patients, and it increased perioperative in-hospital stroke rate in all high-risk patients. Based on this data, carotid endarterectomy appears to have lower stroke rates than carotid artery stenting in all high-risk patients and lower mortality in symptomatic high-risk patients. The final paper we recommend this month is a provocative paper on outcomes of the Japanese multi-center Viabine trial of endovascular stent grafting for superficial femoral artery lesions. It was authored by Dr. Takao Oki and colleagues from Japan. This is a prospective non-randomized case-control study performed in 103 patients, almost all claudicants, and found excellent patency of Viabine stent grafts in patients who also received dual antiplatelet treatment with mostly task C superficial femoral artery lesions. 1 year primary patency was 88 to 92%, primary assisted patency was 94%. Primary patency was 86.5% with lesions longer than 20 centimeters and 100% in those with lesions 20 centimeters or less. These authors suggest that 1 year patency of Viabine stents in claudicants, even with complex superficial femoral artery lesions, are good enough to question whether bypass should remain the gold standard therapy for these patients. These were just a few selected articles from our July issue. To access these free, please visit us on www.jvsearch.org. Enjoy reading all JVS journals and see you next time for the highlights of the August issue of the Journal of Vascular Surgery.